Welcome back. We're looking at the efforts of one relief organization to help the youngest victims of the Israeli-Palestinian conflict. Joining me from Cleveland is Steve Sosbee of the Palestinian Children's Relief Fund. And from Oakland, I'm joined by Dr. Ziad Sabah, a pediatric cardiologist who's volunteered his time to treat several children. Let's get back to our discussions. Perhaps, Steve, with an answer to Hani's question. He came up just before from Saudi Arabia asking how does he put money into the system that would help you?
Yeah, the easiest way, I mean, through international donations and so on, is to visit our website, which is www.pcrf.net. And there's access to the ability to make donations online or other information as far as making contributions. And you can contact us and let us know how you want to donate. If you want to earmark your funds for anything specific, we're doing just humanitarian work. We do food distributions. We do sponsorship for handicapped children. We provide other forms of humanitarian aid, urgent humanitarian aid. So if Hani wants to make a donation, he should go on our website, right. Either contact me by email or contact our organization and let us know if he has any trouble making a donation through the process which is already established, and how he wants to earmark those funds for anything in particular concerning the relief efforts on the ground in Palestine. We're doing a lot of different types of work there, and we need the help of people like Hani to do more. We did
put up the website there for people to check that. Steve, let me ask you an email question that came in, if you'd put this up, if you'd take this for us. It's from Oregon in the USA, and Laura McIlhennan from Oregon wrote in saying, I'd like to know what is being done for children to help them with the psychological effects of living in a war zone. I wonder, do you incorporate anything that looks at the psychological impact that the kids suffer?
Yeah, unfortunately, I mean, this is a huge problem. The number of children in the Gaza Strip, I mean, that's over half the population of 1.5 million people. So let's say 800,000 children in the Gaza Strip. The studies have been done that over 90% of those children suffer from post-traumatic stress disorder, which is as a result of being exposed to violence and those type of things. And so it's an overwhelming problem. It's a huge problem, and there's a lot of organizations which are taking on this problem on the ground in Palestine. Our organization is focusing on a very specific area, which is providing surgery or that type of humanitarian aid, surgical care for children who otherwise would not get it within the local healthcare system. The issue of psychological aid or psychological relief for children who are suffering from post-traumatic stress disorder, for example, which are, I would say, in all of Palestine is over 1 million children. Some organizations, like Physicians Without Borders, is doing something on that. But even more so, I think my opinion on this subject is, as important of this, as this tragedy is, psychological conflict, how it's affecting children, I don't think it can be adequately addressed as long as the occupation continues. You treat a child who's suffering from, you know, let's say as a result of being exposed to violence, like kids like Assad and others, and they go back into the same system. It's a constant exposure to explosions, to the fear of their parents, to the sights of tanks and of dead bodies, and this carnage, which is a daily occurrence in Palestine, particularly in Gaza these days. And how do you treat that when it's ongoing? You treat it one day and it reemerges the next as a source of instability and fear for those children. So really, until the occupation ends, until this issue is resolved, I think it's going to be extremely difficult for any relief organization to take this issue on. That's not saying it's being ignored. Some organizations are dealing with it and doing a good job, working hard to deal with it. But I think the problem is so huge, based on the reality that this is just an ongoing conflict.
Right. I want to get
daily scenes.
Sorry, I was just going to say, I want to get an email to Dr. Sabah, which came in from Oman, from Khalid Al-Haribi, who says, he compliments the organization. He says, may Allah bless the PCRF and all those who are helping people in need. And it makes me wonder, when you go in to help, I mean, obviously you're an outsider going in to help, how are you regarded by the local people? And of course, there's a lot of pressure for you to do a lot more than perhaps you can manage in a short trip.
You know, the people are so appreciative, and you sense that. You know, a lot of times, you know, people thank me for coming, and Steve says thank you for coming, and I'm actually thanking Steve. You know, I just feel so frustrated here living in the U.S. I wanted something to contribute, and I'm fortunate enough to have a subspecialty that may be needed there. So I have the sense of gratefulness rather than the people out there, and to be able to contribute something as little as just, you know, teaching people things that I know, it's great. The people are appreciative. They know the limitations, and they know the system. It's interesting because the system is so fractured in terms of healthcare. They come with their medical reports with them at all times, so they have like their mobile medical unit with them, and so it's kind of interesting. But that's the way it's done.
Ali is on the line from London. Ali, go ahead with your call.
Good afternoon. Good evening.
Hi.
Good evening. My question is basically, I'm a regular viewer of Al Jazeera and tend to follow the events of the Middle East, particularly the situation in Palestine.
Right.
This is the first time I've ever seen since Al Jazeera has been launched, either in Al Jazeera or other main Western-focused media journals, a similar program that has really. I mean, when I saw the pictures, I was shaken. I'm a father of children, and to be very honest, the things we take for granted in here, it broke my heart when I saw those pictures. The question is, can the media be accused of not publicizing the plight of Palestinian children, but focusing political issues such as war? What's being said?
Ali, let me put this to Steve and ask, how difficult has it been to get publicity for your cause? And let me put it in this terms also, because an email came in from Kansas from Deborah Plummer, and it touches on a similar issue. It says, what can the PCRF do to bring knowledge about the situation between the Israelis and Palestinians and other Middle East problems to Americans?
Well, the first question is how difficult it has been to get exposure for our work, our humanitarian work. And I think locally, within the local news media outlets in the United States, it hasn't been that difficult. For the most part, these are humanitarian stories. They're looking for a humanitarian angle. We have doctors treating our kids for free. These are kids who are coming. They're innocent victims of war. So that's a good story, and it kind of sells itself, basically. We have had problem getting in within the Arab media, I'm sorry to say, including Al Jazeera and some of the other larger Arab satellite channels in the Middle East. I don't know for what reason. Maybe it's just we haven't reached the right people, but we have been kind of cut off from that exposure. And I think this is our first chance, and we thank Al Jazeera for this opportunity. It would make our work a lot easier if more of the Arab community knew of our work and were able to support what we're trying to accomplish. The other question, could you remind me what that was?
Yes, it was really asking about, you know, bringing better knowledge about the Israeli-Palestinian situation to Americans in particular.
Yeah. Well, I think by having these kids come here and, you know, they see children like Assad in Philadelphia, who's a triple amputee as a result of just playing soccer in the street of his village. I think Americans see that, whether they're healthcare providers or they're everyday people who run into him in the hospital or in a supermarket or wherever he happens to be at that time, and the hundreds of other kids which we have in this country being treated. And they start to ask questions, and they start to say, well, you know, this is an injured child, but he's Palestinian. He's not Israeli. All I hear about are Israeli casualties in the American news. Or if I hear about the Arabs, it's just statistics. It's not faces. It's not, you know, a name or a personality. And here's this boy, and he's smiling, or he has this disability. And they start to ask questions. So I'm not a politician. I'm not interested in that aspect of politics. My job is not to educate people, but I think the important part of our work does include some form of exposing what is going on in Palestine to the American public, which has been kind of cut off from the reality on the ground there. I think everybody who goes there, all of the doctors who we send there, not just people like Ziad who already knows what's going on in Palestine, but hundreds and hundreds of doctors and nurses who we send from Europe and America who are not Arab into Palestine, they all 100% walk away feeling very much sympathetic with the Palestinian situation from a humanitarian perspective. They all come back saying, I want to go back, I want to do more, those people deserve my help.
Well, listen, Steve Sosbee and Dr. Ziad Sabah, thank you very much for being with us. The pictures were disturbing, but sadly they are a reality. Congratulations on your work. I wish you a lot of luck with that.
Thank you.
Thank you
so much.
Thank you for joining us. From me and the team, we'll see you next time.